Abad. I'm a nurse practitioner from California. I'm also a doctorate student from Duke University, and I would like to revisit the Senate Bill 491 introduced by Senator Ed Hernandez of West Covina. Senate Bill 491 would have allowed nurse practitioners to practice to the fullest extent of their training and education. However, the bill did not reach the Assembly Appropriations Committee because it was strongly opposed by the California Medical Association. Their argument is that nurse practitioners should not work independently and should always collaborate with doctors. The Senate bill is not expanding the scope of practice for nurse practitioners. It is basically delineating the supervision as a barrier to patient care. In a year or two, the fight continues, and I would like you to be one with us, to understand that access to care is really important, especially anticipating the newly insured residents of California with the Affordable Care Act in place. I would like you to now join me and review Senate Bill 491 to continue to fight for what is right.
I'm here for the same thing again, my sinusitis. My sinuses are acting up. I need a refill, the same thing as usual.
Oh yes, Mrs. Brown, we did see you for the same thing, and we'll make sure that you get the same medication, and we'll take care of that today. For the meantime, I need for you to wait, and we'll get Dr. Smith to come here to see you. Okay?
I waited already quite a bit.
Yeah.
Why do I have to see another person? I just need a refill.
Yeah. So we do follow the same procedure, and I'll have Dr. Smith come here before you get discharged. He needs to see you first.
Wow. Okay. I guess I'll wait then.
Okay.
Thanks.
Thank you, Mrs. Brown. I'll be right back. There are different institutional rules and regulations that govern the California state policy that the nurse practitioner work under a standards of procedures and under a supervision of a medical doctor. A situation like Mrs. Brown, who I just saw as a nurse practitioner, she came here for chronic sinusitis. She can't be discharged until the doctor sees her. This creates delay of care. There are also situations where the waiting room is flooded with different patients, and due to the barrier of the MD's supervision for the nurse practitioner to see patients, the waiting room creates a delay of care, decreased access to care, and wasted time, because the patients at times will leave the clinic and will not wait for the doctor or nurse practitioners to see them.